The disease that I chose is kleptomania. It is a mental disorder characterized by addiction to stealing things, not for monetary gain or personal use. Unlike most thieves who steal because they don't want to pay, kleptomaniacs feel they have to steal and can't help themselves. It has only been intermittently recognized by the American Psychiatric Article System Association as a type of mental illness since the 1950s. It was first described as a psychological disorder in the 1800s. The American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders has outlined the following criteria for a diagnosis. The first, the individual repeatedly fails to resist the impulse to steal items that are not needed for personal or monetary value. The second, the individual experiences tension before stealing. The third, the individual's tension is relieved or gratified by the act of the theft. The fourth, the theft is not due to anger, revenge, delusions, hallucinations, or impaired judgment. The fifth, other psychological disorders can't account for the individual's stealing behavior, like manic episodes and antisocial behaviors. With the diagnosis criteria in mind, kleptomania as a true condition occurs in a rather small percentage of the population. While no true estimate of the general population is available, scientists estimate that kleptomania occurs in 5 to 10% of psychiatric patients. Kleptomania tends to occur in women more than men. However, there are some gender bias in this finding because women who steal tend to get psychiatric evaluations while men who steal tend to go to prison. Similarly, there doesn't seem to be any one social group in which kleptomania is rampant. Usually, kleptomaniacs have parents who have abused alcohol or drugs. The causes of kleptomania have been found to be a defect in a molecule that transports the neurotransmitter serotonin, head trauma, which is damage to circuits between the orbital and frontal lobes of the brain, or low blood flow to the temporal lobe, decreases in the fine structure of white matter in the frontal lobe. This could alter information flow between the frontal lobe and the thalamus or limbic system. There are many therapies that have been used, but there have been mixed outcomes. Selective serotonin reuptake inhibitors like Prozac, Paxil, and Luvox have been used to treat kleptomania, but case reports of these treatments have demonstrated mixed results. There's also been cognitive behavioral therapies. One is covert sensitization. When the patient feels the urge to steal, he must imagine negative consequences until the impulse goes away. The end.